So, and we are recording now, I believe. And now we're going to go on to our agenda, where we're going for this meeting. First, one of our co-founders, Liz, is going to do a year in review. And then we're going to have two current PA students. Liz, again, our co-founder, will introduce them to talk about their experiences in PA school with hidden identities. And then we're going to give you a little bit of resources should you need that. We're going to open the door for Q&A. Then we're going to have some announcements and talk about our board of director positions. And we are 2 years old officially this month. PAS Lead, which is a student-found, student-run completely group, is officially 2. Hopefully we avoid our terrible 2s and just have a nice, smooth second year. But we are 2 years old. This is a huge deal for us. We have made it completely running from grassroots efforts to the point that we are now, which is amazing. And to talk a little bit about, thanks for the happy birthdays, everyone. Talk a little bit more about basically our 2-year journey is, again, Liz. So she's gonna take it away and talk about our timeline.
Thank you, Tiffany. And again, thank you everyone for the happy birthdays. So many of us started our programs or were in the thick of our programs during the height of COVID, or where everything shut down and we're still dealing with it. I know we're sick of it, y'all, but COVID ain't sick of us. Unfortunately, in May of 2020, George Floyd was murdered, and in the weeks following his murder, AAPA held town halls for faculty and students as a safe space to discuss racial injustice going on in various programs. Following this, many students came together from the town halls for the first student-run meeting to create a PA student organization. It was going to be run by PA students for PA students. In August of 2020, PAS Lead officially got its name. It was really important for the founders, who many have now since graduated, create a name that was not only easy to remember, but also a name that stood for something. The name was coined by one of our founding members, Alexandria Ladia, who has recently earned her C and moved up in the world. Thus, PAS Lead, Physician Assistant Students for Leadership, Equity, Anti-Racism, and Diversity, was born. In September of 2020, we came together for our first national meeting, introducing who we were to the world. By November of 2020, we had the tumultuous presidential election, and we also had our first PAC discussion panel, where we want to give a special shout out to Dr. Datheon Sturgis, a PAC who was a PA educator, and Sato PAC, who practices in California and is an advocate for underrepresented minority students. Fast forward to May of 2021, the House of Delegates, of which 2 of our founding members belonged, participated in the historic vote to change the title of the PA profession to physician associate. Next slide, please. Oh, sorry. So what have we been doing since this time last year? During 2021, the AAPA conference was still held virtually, and we were able to host a 1-hour talk about PAS Lead. We introduced the organization and talked about the resources that we offer students, such as our toolkit, which is something that we're really proud of, and you can also check it out on our website. By December of 2021, we held our first annual Racial Social Justice Conference. From our inception, it was something that we had been talking about, and our hard work paid off. We had various speakers come through discussing advocacy, diversity, systemic racism in medicine, and our keynote speaker was Dr. Jackie Edwards, who spoke about racial and social injustice online. We're going to talk more about our plans for this year's conference a little later. In January 2022, we know about the insurrection on Capitol Hill, and in February, how Russia invaded Ukraine. In March of 2022, we decided as an organization to try to dedicate our March national meetings to our pre-PAs. It went very well this year, as we had a current program director for one of our members of the board, Deepthi, of her program director came to speak, and it was very well received. By April of 2022, we participated in a PAEA virtual fair presentation that was also very well attended. In May and June of 2022, we know about the terrible mass shootings at the grocery store in Buffalo and the school in Uvalde. All of these events affect us as underrepresented minorities in PA education, and it's part of the reason that we hold space in June for our anniversary meeting. It's because so much has happened in these past 2 years that drive us to keep going and drive us to keep doing what we set out to do in June of 2020. It's very important for us to take a look back at our journey to see where we started so that we can look to where we want to go, and hope that you're going to continue on and be a part of this journey with us. We've come a long way, but we still have so much farther to go. Thank you for being here, and know that even baby steps are steps in the right direction. We hope you'll continue to work with us as we try to do as Mahatma Gandhi says, be the change you wish to see in the world. And now we're going to hear from some of the experiences of current PA students in their own words. Next slide, please. One more, please. First, we're going to start with Haley. Haley is the founder of the Humorous Med, Shop the Quirks, Doing It Disabled podcast, and so much more. She's a clinical year PA student in Florida and lives with dysautonomia, which she chronicles on her podcast and on her Instagram. Please welcome my prima, Haley, as she talks to us about what it's like to be a POTSI in PA school.
Hi, everyone. Thank you, Liz, first of all, for inviting me. And also thank you to all the directors and all the students that participate in this org. I think that it's very important, and I'm just really honored to be here. So again, my name is Haley Diaz. I'm a first-generation college student. I'm Cuban American, and I have a disability called POTS. It stands for Postural Orthostatic Tachycardia Syndrome. I wouldn't necessarily say that it's a hidden identity of mine, but it definitely was when I first started PA school. When I was applying to PA schools, I was cautioned by all of my mentors not to include the fact that I was struggling with my health at all in personal statements and interviews. When I went to my interview, I was told, do not bring anything up, like, basically mask as much as you can your symptoms, because there's a chance that they won't let you in because they think that you can't handle it. So at that point in time, it very much was a hidden identity, and I was petrified to disclose anything that I needed, anything, how I was feeling. Also, I'm sorry, I am at the beach. I am visiting my family. I haven't been here in 2 years. So in case you hear a lot of noise, just let me know. But, it was just, I was in a constant state of anxiety, essentially, even after I got into my program. Because of COVID, there were a lot of seats taken out for social distancing and whatnot. And even in the OSCE rooms, when you would go to complete an OSCE, there wasn't a place for the student to sit. There was a place for the patient. And that was the first time that I needed to actually say, okay, let me request accommodations. I had to go to the Student Office of Disabilities and state that I needed a mobility aid. And that's when everything kind of exploded in my face. Not even 2 weeks after that, I was being pulled into meetings with the director of my program. I was essentially being encouraged to take a medical leave. And this came from solely stating, hey, I'm going to pull up with a mobility aid to my OSCEs, not asking for anything else. So I got very depressed. For a while, I felt like I couldn't do it, that I was having imposter syndrome, everything that you could imagine. I was experiencing it. I had to go to therapy. And, eventually I said, pardon my French, I said, fuck this. And I said, I can do this. I know I can do this. Why? Because I got to this point. Even dealing with everything that I've dealt with, I've got to this point. And I know that I can handle it. The problem wasn't, can I handle it? The problem was the institution understanding my capabilities. This was something foreign to them, and they didn't know what to do with it. And so there was a lot of questioning and a lot of doubt on that end. It wasn't so much that I couldn't do it. It was just, I needed certain accommodations that needed to be disclosed and that needed to be accepted as it would anywhere else. So I would say at the beginning of didactic and even through didactic, I was very anxious. It severely impacted my PA school experience. I'm so grateful for my classmates that are now some of my best friends, because they were the ones that told me, what's the problem? Like, you were an MA, you were a scribe, what's the problem? Like, of course you can do this. oh, you need a break, you're scared that they're going to say something, okay, here, we'll do, we'll figure it out, we'll take turns, you can go first in the OSCE and then you can sit and be the patient, I won't have you waiting that whole time. Like, we would figure it out amongst each other. And now I'm in my second year of PA school. I graduate next month. I've gone through all of clinical year. I just finished my surgical rotation. Everyone was saying, oh, you're not going to be able to get through surgery. And I said, why not? Thankfully, I was able to go to the VA, which is an extremely accessible institution. We have the spinal cord injury clinic. So I'm in my scooter, and all the veterans that have that are paralyzed or have some sort of mobility issue are in theirs. And, we make jokes and we have fun, but there's a surgeon that's paralyzed. And so they just bring the table down for him. And, nowhere in the technical standards does it state that you have to, or that you can't go to the bathroom for extended periods of time, that you can't eat for extended periods of time, and that you have to stand for a certain amount of time. It just says you have to be able to stand for long periods of time. And that in itself is ableist. So, with a simple conversation with my preceptor, he said, okay, let me reach out to the chief of surgery. And I was allowed to take my scooter into every single OR that I had a case. If I wanted to scrub in, I would scrub in for 15, 20 minutes at a time. Everybody in the OR knew, and it's not anything crazy, right? So when you have POTS, you have your fluctuations in your blood pressure and your heart rate, and they get worse the longer you stand. So you could pass out. That's the big deal with POTS, is that you could pass out. And there's a lot of patients that do pass out multiple times a day. Thankfully, mine is controlled at this point. But I can't tell you how many classmates I've had that do not have any medical conditions that we know about, and they passed out during surgery because it's just not normal. It's on the human body unless, you're trained for it. So it was the same. They gave me the same advice they gave any other student. If you feel lightheaded, you step back, you drop to your knees, and the nurse will take care of you, but that was it. If I could have asked my program to do anything, it would have really been just to have my back. And I want to make it clear that it wasn't my entire program. It was just a certain subset of faculty that made it very difficult on me. I thankfully have had a small group of faculty that have been very supportive of me and that have helped me get through. But I would have loved for them to, consider places when they were sending me, if the place was accessible. It's supposed to be, it not always is. Sometimes handicap buttons wouldn't work on campus. So I'm trying to get in with my scooter and there's no way for me to access the building. And that's unfortunate because I go to school in Miami, Florida. You would think that a big city like Miami would have handicap buttons, working all the time. Just communication with my preceptors, if, they could have just reached out, or if not, just been like, hey, it's fine. Like, if you have a problem, let me know. I wish that would have been the case. But other than that, if anyone has any other questions or anything, I'd be more than happy to answer.
Did anyone have a question that they would like to ask Haley? Go ahead, Karina.
Hi, Karina.
Hi, thank you so much for speaking and letting us, know a little more in terms of your personal experience. My question was, did you feel that, or did you find yourself having to reach out to preceptors ahead of time, or did your program kind of take that on for you, or at least think about taking that on for you sometimes?
That was never done for me. That was never thought of. On the contrary, right now I have my last rotation is in psych. My school lost multiple sites for various reasons, and they're sending everybody right now to the prison. The prison told me that my mobility aid is a safety risk, so it cannot come in with me to the prison. My school basically was like, oh, well, what are we gonna do? We do have another site available, so I'm in the process of trying to go to that other site, but that's essentially a prime example of, the lack of caring. There is no coordination with them in any regards. Like, hey, let me maybe put her at the VA because of this. I got put at the VA, thankfully. That was a coincidence that I got put at the VA for surgery. It's been my classmates more than anything else that have spoken to a preceptor that if they know that I'm an incoming student to that rotation, they'll say, hey, I have a classmate that's disabled. Do you think that there'll be a problem? The answer has always been absolutely not. There's never a problem. We have to accommodate her, right? So it's kind of crazy to see that gap between academia and real world medicine. It's like nobody has a problem with me. Nobody questions me. So I get looks sometimes and people will walk up to me, healthcare professionals, and they're like, hey, why are you using that thing? Yes, absolutely, all the time. But that doesn't bother me. It's been the academia aspect of it is, the technical standards. That's just, it's ableist. There's no better way to say that. And, I'm working right now to try and hopefully change them moving forward. But it just saddens me to think that if this was solely because I was using a mobility aid, what would happen to somebody that shows up to an interview in a wheelchair? Are they going to be automatically disqualified or eliminated in their eyes because they're not capable? Meanwhile, you have had dozens of students that are paralyzed or in wheelchairs or use other mobility aids at other institutions, so.
Thank you so much. And just to kind of follow up with that, do you feel that for other incoming students that's like something that they should be asking the programs, like, or are there specific questions that they should ask programs when they're applying?
This is a very difficult question. What I can tell you is that I have 5 students with chronic illnesses / POTS in the little class that just came in. I think it's class of 2024. And all 5 of them had reached out to me prior on Instagram and spoken to me and asked me, what do they do? And I gave them all the same advice. I was like, you don't have to say anything. Nobody has to disclose anything that they don't want to, right? It's unfortunately when it becomes visible that you have to disclose things like using a mobility aid. At the end of the day, no one should have to ask a question like, hey, are you going to accommodate me? Because it should just be done. But that's not the reality of the world that we live in. So, the only thing that I can think of is to reach out to students maybe that do have a disability or chronic illness that you've seen or that they've seen on social media or that they know, like, hey, how would this be handled? But again, it's really unfortunate that you have to go about it in that way. But I'm going to keep advocating on my platform. That's the reason why I started my platform, was because I didn't have somebody to look up to. Like, I just literally 2 weeks ago met a PAC with POTS, but up until this point, I kept thinking, I don't know what's next for me. I don't know how this is going to look for me in clinical practice because I don't have anyone to kind of serve as like a model or a template for me. So the fact that after I started the page, people started reaching out like, hey, I'm a PA student with POTS. Hey, I'm a pre-PA with POTS. It's like, okay, cool, we exist. It's really not an uncommon condition. It's just not educated, right? We're started to learn more about it because of COVID, but it's not rare at all.
Thank you so much for sharing. I have also a quick question. So have certain specialties been more accommodating for you and been more welcoming? And has that influenced what kind of specialty that you think you'll go into after you graduate?
It's pretty ironic, but the most accommodating specialty has actually been surgery.
That's amazing.
Yeah, like I was petrified of that one. And also ER, I'm in ER right now. I was absolutely petrified of both of those, and I got them back to back, but they've been very accommodating. I don't have a problem with anything outpatient, like at all, because, thankfully I've been able to go through 2 rounds of treatment. And when there's a seat involved, I can be up and down walking around, no problem. When it comes to the hospital, it's not very, it's a bit harder for me. I can do it because I've done it, but it's a bit harder. You can see where there's lack of accessibility in the hospital as a provider, which is ironic because there's accessibility as a patient. For example, I was at a major hospital down here in South Florida, and when you're in the outpatient offices going into the hospital, on every single floor, there is a lift that you have to use if you're in a wheelchair. To use this lift, you have to call security every single time. And it's because there's 4 or 5 steps in between. And because it wasn't ADA accessible, or compliant, they had to put in that lift. the lift broke on every floor one day. And thankfully I am able to, but I had to literally close up my electric scooter, which weighs 70 pounds, and carry it up the stairs. That's not accessible. And what if I couldn't walk? What if I couldn't get up? What if I couldn't carry that? So that was my nephrology rotation. Obviously, if I were to work at that hospital or something, they'd be hearing from me, but it's just not okay. I personally see myself in something outpatient just because of the way of my condition, the way that it is. But it really opened my eyes during my clinical year that I could work in the hospital. I thought that that was something that was going to be automatically taken off the table for me, and it's not. So that's been nice.
Thank you so much.
Yeah, thank you.
Hi, Haley. I have a quick question for you. You brought
Hi,
up something.
Tiffany.
Hi. You brought up something very interesting, which I want to elaborate. I want to ask you on. Why do you think that there is such a gap in between like accessibility and accommodations in the like clinical or like the real world in the hospital versus in academia? Like, why is academia afraid to give those accommodations to students? Like, why do you think that there's such a gap? Because I've experienced this as well. Like in real working world, you can get X, Y, and Z thing, but during academia, the accommodation is harder, or there's more of a fight, or there's more of a worry, more of your failing.
So 2 things, and I think we can all resonate with at least one of them. Number one, the education system in general is not structured properly. We do a lot of things from the time that we're 5 years old through college that are completely unnecessary. Okay, it's a waste of time. Instead of doing, certain things like meaningless assignments, we could be doing hands-on activities or more immersive learning. Okay, so number one, the structure of things, the standard of things, it's just not efficient. It's not the way that it should be. And I think that we can all resonate with that at one point in our educational career. Secondly, there's this horrible misconception that medical professionals have to be indestructible, that we have to be superheroes, that we have to, we can go 48 hours without sleeping. It's toxic. Even if you pull a nephrologist out of their specialty right now, a physician, and you have them work in OBGYN, they're not going to be able to do it. Number one, they don't have the same training. And number two, they're not used to probably being up that late or carrying out the tasks and responsibilities of the other specialty. So it's great that we have our clinical year and that we're thrown into these different specialties, but most of us are only there 4 to 8 weeks. We're not going to become masters of that specialty. It's solely to give us insight to learn so that we know how that specialty functions and if we want to go into it or not. But even as PAs who are trained as generalists, we're not going to be doing everything. So to take that and then put that on a person who's chronically ill or disabled, you have to understand that that person might not be able to do emergency medicine, but maybe they're going to be a badass internal medicine PA. Like, we can't just put this blanket statement on every student that we're just going to be amazing at everything or that everything's going to fit with us. That's not the way that life works. We're, somebody's an accountant, somebody's a PA, like everybody's different. So I think that gap just comes from a horrible perspective that I hope that we can change. That doesn't mean we need to remove like all the rotations or whatever. It's just, I think we just need to be more open-minded. Like, oh, you struggle with this? Okay, let's change it around a little bit. And again, the technical standards need to change. They're completely ableist. Even if you look at a job application now, it'll say, can you carry 50 pounds? Can you carry 75 pounds? I'm sure more than half of you'll know that your preceptor probably can't carry 50 pounds for more than 5 minutes. That's just the reality of life. So yeah, it just sucks. There's no other way to say it.
No, thank you. That's a solid answer. And to tie on with this, how do you think that what you faced during your didactic and clinical year, while you have had great support from your classmates and small subset of your faculty really was supportive,
Yeah.
For the students who go through this, even any type of disability or trying to get accommodations, and they don't have that support, how do you think then in turn would change your outlook on wanting to be a PA, wanting to work as a PA? Like, how do you think it would affect your PA school burnout?
Oh, I don't know if I would have been able to do it, if I'm being completely honest. And I'm the type of person, and this might be my internalized ableism or toxic in myself, but I'm the type of person that when I start something, I want to see it through. So it would have been extremely difficult for me. I mean, I did need therapy. I probably would have needed to be consistently in therapy, which is expensive. But, or at one point I would have had to drop out because they just would have made it so difficult for me. That support has been instrumental in my success. I wouldn't have been able to do it without my classmates. I really believe that. And, you know, at the beginning, it wasn't because I couldn't do it. It was because there was so much doubt being placed on me. And it was a constant thing that I needed somebody to be like, yo, get up. What are you doing? Like, don't let them treat you like that. Because I couldn't do that for myself at that point. I had just been diagnosed with a chronic illness. The outlook wasn't great. COVID was going around. I didn't know how COVID was going to affect my condition, which is horrible, by the way. You know, I just had constant throats going to me, and they were the ones that really helped me say like, no, you're okay. You belong here. You're good. We got you. What, you need help today taking your mobility aid off the car? Okay, that's fine. What, you don't feel well? You need a 5-minute break? Okay, that's fine. Let's go. Like, what, you need a snack? Okay, I'll go get one. Like, you know, those little things really mean a lot to me. So I feel horrible. I feel for the students that don't have that. And again, that's why I try and have my platform, but I know that not everyone resonates with it. Not everyone has the same condition, and all that I can hope for is that people do find that support in somebody.
Thank you, Haley.
Yeah.
Awesome. Thank you so much, Haley. Thank you so much for being here. We're happy to have you stay. We're going to transition on to Kayla, one of our directors, who's going to talk a little bit about her experience in PA school. So I don't know if you want to hang out, Haley, or if you want to go. Totally up to you.
Yeah, I'll hang out for a bit. Thank you.
Awesome. Thank you so much. So Tiff, can I get the next slide, please? So next up is going to be Kayla. She is one of our newest directors. She's an incoming clinical year student in Tennessee and is going to be talking about being a neurodivergent in PA school.
Hello, everyone. Thank you so much for coming. I'm Kayla and I have ADHD. I didn't get diagnosed until really late in life, but we'll get into my story a little bit later. First, I want to start off with some myths about ADHD, and a lot of these maybe not true that everyone believes about ADHD, but at least in my experience, these are some things I've run into. So if anyone has comments throughout the way, like throughout the presentation, just like throw them in there. I'm more than happy to Bob you guys. So ADHD presents the same way in males and females. This is one of the biggest points I want to hit home about. This is not true at all. So typically we expect ADHD and boys to be more hyperactive and way more apparent, as young as, maybe elementary school. And then, so if the girls are not hyperactive and disruptive in class, they're not the ones that get diagnosed. And a lot of times they typically do not have that type of ADHD. There's two types, actually 3 types. So there's a hyperactive type, the inattentive type, and there's a combination of both. So this is also why a lot of girls don't get diagnosed until later in college, when they finally have they've gotten out on their own. There's a lot less structure in the school day. They don't have their parents looking over them constantly to say, hey, it's time to do this now, make sure you're on task. And then they wonder why they can't focus in class. And then they hopefully start reaching out for help, and kind of looking more into why they are the way they are. But a lot of people still don't even get diagnosed. A lot of women don't even get diagnosed until potentially 30s. So people with ADHD are always hyper. Again, this is not true. Girls, you don't really see as hyper. We are the daydreamers. We're known as the daydreamers. We'll be completely calm in class. You'll never notice that we're off task unless you're sitting behind us, and people have seen me behind me in class working on a bunch of random stuff that is not pertinent. to anything we're talking about. A lot of times it's Excel sheets that probably aren't the most pressing at the time, but they're very pretty, and they're very, very colorful. So, and a lot of times I'm working on diversity things in class because that is the most pressing thing to me, apparently, for my SGA role. And that is just the more interesting thing to me than sitting in class. Not necessarily that the lecturer is, they're not boring necessarily. But for some reason, my mind just can't focus on the right thing at the right time. And I shame myself for that a lot. And I'm trying to work on not doing that as much. Anyway, so myths about ADHD. The third one is most people get diagnosed between ages 7 and 12. Again, not true. That's typically for boys. They expect that. And like I said earlier, girls can get diagnosed anywhere between, any age really. If they're hyperactive, they can get diagnosed younger, but if they're inattentive or have a combined ADHD, they'll get diagnosed as late as 30s. And that's only if if it's so disruptive to their life that they're seeking help. A lot of times they could go undiagnosed for, potentially their entire lives if they don't believe in, ADHD or like mental health kind of things. So don't quote me on that because I'm not 100%, but I'm just imagining that it could be very hard to ask for help. And there's a very strong possibility that people could go their entire lives without getting help or knowing their diagnosis. ADHD brains always struggle to focus. This is absolutely not true. Like I did say, I struggle with this on the right thing at the right time. But when I am focused on something, a lot of times you cannot pull me away from it. Like my Excel sheets. And other things too, like I like working with my hands a lot. So one day I spent 3 hours working on a little house for my cats, so they would keep the litter in the litter box, right? It was so cool and so fun to me because it was like working with my hands, and I'm kind of like a little engineer up here, but I don't really know a lot about engineering. Just things like that. Like I'll spend the longest time working on the most insignificant, less pressing time-wise for my schedule thing. So if I will not a lot of times do chores until it's a disaster, but I will do chores when it's time to study, because then that way I can procrastinate and I can, get my area right before I sit down and try to get my studying organized. That is the hardest thing. I think I find a way to organize my studies, and then it kind of works. And so I change it the next time, and it kind of works. So I keep waiting until the last minute. It's hard to get consistent with it. And so I will tell you now, I still haven't gotten consistent with it, and that's still a struggle for me. It may never get better. Somehow I'm still here. I don't know. Drug seeking behavior is common. I hate this one because I personally have faced this with my providers. At first we had a really good relationship and rapport, and I actually have a provider that's still in North Carolina. That's where I'm from. And I asked her, I said, if are you okay still prescribing me while I'm in Tennessee? And we talked about that a lot, and she agreed. It was fine. Well, I turned 26 and I got kicked off my parents' insurance. And so I lost insurance for a while. And of course, not prioritizing my time correctly, I didn't get insurance right away. So when they came for the next prescription, I didn't have $180 to pay. And I was like, hey, can you transfer my prescription, please? But transferring a controlled substance is very frowned upon, especially when you ask them 3 or 4 times because suddenly they didn't do it fast enough. Now you're on Thanksgiving break and not even in the state anymore. So can you transfer to this pharmacy? But they don't have this Harris Teeter didn't have a pharmacy. So how was I supposed to know? Like what? That was stressful because finally they told me, and this was finals week, by the way. Finals week. Oh, sorry, we're just not going to transfer a prescription from Tennessee because we're not comfortable with it. And I said, it's finals week. I have papers to write and I have tests to study for, and I'm not driving for, a total of 8 hours there and back just to get a prescription. I've only been on medication for a little over a year. So obviously I've been doing this my entire life without medication. I can do it again. but I was not happy about it for sure. Medication is the only treatment. Obviously not. I think what helped me the most when I was in grade school was all the sports I played. That was my structure, and that helped my brain focus a lot more. And of course, as soon as you get to college, you're not there to play sports all the time. And while I could have gone, I actually had a lacrosse scholarship to a school in Virginia, but you don't go to a school to play lacrosse and turn down, a renowned school in the state, right? So of course my dad was like, yeah, you're going to go to UNC, Chapel Hill, which I'm glad I did. I learned a lot there, and I became much more open-minded to diversity. And I credit a lot of my self-growth toward that school. But anyway, there's exercise, diet, sleep, that's a big thing too. But it's so hard to put effort into doing everything right. Sometimes you don't feel like it. It's hard to prioritize those things because I got to study. Well, I'm going to waste 4 hours studying to get maybe like an hour's worth of information out of it, when I should just do the right things. I should be sleeping 6 to 8 hours a night. I should be exercising for at least 30 minutes a day, but I don't all the time, except for the short couple months where I was training for a half marathon with my friend. Thank goodness that she actually started that, because I wouldn't have done it without her. But there's so many things we can do for ourselves that are kind of like self-care. In this case, or almost should be like mandatory for us, right? Part of our care plan. But that we don't prioritize because of being in school, or, having a job, or, just life being crazy. Yeah, there's plenty of other options for treatment if you are not wanting to seek medication. So the last one is something that my parents, I think, believe, which is very unfortunate. People with ADHD have a lower IQ than on average than neurotypical individuals. Notice I didn't say normal. That is not we don't use normal when we're talking about neurodiversity. So that also goes with intellectual disabilities. We refer to them as typical or neurotypical, or what did I say? Neurodivergent, I guess. Anyway, my parents basically told me like, oh, you don't have ADHD. Like you're so smart your whole life. Like you've been doing all these things. There's no way you can have ADHD. But especially in girls, we compensate for all of our inattention by staying up late at night. So I can't tell you how many all-nighters I pulled in middle school. And there's no reason that a middle schooler should have to be pulling all-nighters just to get her projects done that she's had probably 3 to 4 weeks notice to work on. It's not healthy. And of course that my roommate from Costa Rica study abroad program that I was in that first noticed how much longer I was spending on the same amount of work that she was doing. And she was the first person to say, hey, do you think you might have ADHD? Like, would you want to get checked out? And I was like, oh, no, it's fine. I don't think so. So it took a couple people before I actually considered it something I was curious about. Time I was ashamed of even thinking that I might have ADHD or some kind of disability, mental illness. Wasn't sure what to call it at the time. It's a learning disability. But it took me years before I ever got the courage to get tested or even talk to my parents about it. And not my dad, my mom, because I only talked to her basically about my actual personal life. My dad is just so closed off to a lot of things, unfortunately. And her being the open-minded one and the one I talked to the most, even she was like, no, you don't have ADHD. I'm a nurse. I would know. Do you specialize in psychotherapy? Like, I don't think so. So, she does work with kids, but she also didn't know that there's 2 different types of ADHD, that just because I'm not hyper all the time doesn't mean I don't have it. We actually pulled up I think she was reading an article one time about all the symptoms of ADHD, which we'll get into the next slide. And I was like, Mom, this is me. Like, do you see how many things I match up on? And she's like, nah, you probably don't. You still probably don't have it. But the biggest one there was forgetful. And all of my life, my parents have complained about me leaving things everywhere. And like, I got to the point where I would start trying to buy replacements for things so they wouldn't notice, because I was so ashamed to tell them that I lost them. And of course, like it's really, they're very sentimental things that I've lost and I never will get back. So it's not like I intended to lose them or that I was irresponsible. It's just that my mind is so many places at once. I remember spending like 3 to 4 hours just trying to track down all the things I had lost over the past week or so on a day. And it was probably before a test too. So I, not having a car on campus at the time during college, was taking the bus routes around all over the city to try to figure out where my rain jacket was. And I got all the way out to the very last stop and like probably walked a mile or two to get to the station where they had lost and found, and it still wasn't there. So I was wasting my time. It was really frustrating. My dad still doesn't know that I lost a pearl necklace he gave me. I left my phone in Costa Rica on the way to the plane. And my dad thought I had kidnapped because my phone was traveling all over Costa Rica and not to the airport. But of course, my phone died. Sorry, I couldn't, thing. And my mom wasn't worried. I forgot it. I actually did get the phone back though, interestingly enough. I was very lucky. I happen to be lucky a lot of times, but not always. People can be described as disorganized. If you ask my mom, she would say yes, all her life she's been disorganized. Her room is always a disaster. But when it comes to things that I'm passionate about, I'm very, very organized. So it just depends on what you're interested in. And if it's something you care about, then we have strengths in that area, as anybody else would, right? People can be socially isolated, and there's a couple of videos on YouTube, you can see like 2 6-year-olds, one with ADHD, one without, and it's just so sad to watch. She's like, they're asking, do you have a lot of friends? She's like, no, not really. Like, I don't really talk to anybody because I feel like they just don't like me or whatever. But it's really easy for us to get in our head about social interactions and just to ruminate over them and to think that either we did something wrong or we should have done something better, and they probably don't like me because of this, that, and the other. And then you go back and ask your friends or the people about the interaction that you had, and they're like, oh, I didn't even notice. So we waste all of that time just thinking about what we could have done better, or if we accidentally offended somebody in a situation. Anyway, so here's a big one for me. It takes longer to process information. I have noticed this a lot this year. I have Sims. I will go into the room and I realize that I feel like people think I'm just kind of maybe absent-minded. I'm not really sure if anyone can attest to that I've had Sims with on this call right now, but it seems like I sit back and take a minute, which is good. Like, I don't seem it to be stressed on the outside. I eventually get there though, and I do help my team get to the right answer. But at the end of the sim, I always think I didn't do anything, that my contributions weren't worth anything, which is not true. I'm trying to believe that, but anyway, there's so many things on this list. I'm going to try to only highlight the ones that are most affecting me. The work's hard to gain approval. I cannot tell you how many things I've done just to make my parents happy, and maybe felt ashamed or avoided telling them things that I knew wouldn't make them proud or make them happy. But I had to eventually go through a very hard transition where I was like, okay, like, my life is mine. I have to make my own decisions. And if it makes them happy, that's great. But if it doesn't, I still have to stay true to myself. And I'm still struggling with that today, honestly. But yeah, not just parents, but like everybody around me. And like I said, it's very easy we have high standards. I have high standards for myself. And there's been times I've had like a complete, I don't want to call it a meltdown, but just I've had a hard time accepting the quality of my work, and because I a lot of times think it didn't make people proud or it didn't do a good enough job. So there's that. I don't know how my mom can't see that I have ADHD because I am so late all the time. My parents have and my sister have started betting on how late I'll be. I don't know if there's been any money involved yet, but like they keep saying that, yeah, how late is she going to be to the wedding? Oh, she'll probably be like 10 minutes late or like 30 minutes or an hour. I don't know. But yeah, I can't tell you how many weddings I've been late to this year, as hard as I've tried to be on time, and it's really upsetting. And it's not that I intend to be late. It's I plan for this amount of time to get ready and to get there. And I'm a pretty simple person. Like I don't do a whole lot of like makeup or anything. So I'm just like, I'll put my dress on, I'll get a shower, put my dress on and go, right? Simple. I don't account for traffic or whatever, but and I am often guilty of slipping in the back of class, hoping that no one notices, or sitting, actually, there's a wall, sitting in a chair behind the wall so that nobody can even see me come in because I'm so ashamed to walk in late. And it happens so often. Don't tell anybody from my program, please. Probably noticed though anyway. I mentioned daydreaming quietly in class. For me, it's not really daydreaming. I'm just totally not on task. It's not even, the problem is once I get an idea in my head, I really can't put it on the back burner, even though I know it's not the right thing to be focusing on. I'm a perfectionist, so, and pretty artistic actually. So whenever I had art projects in high school, I would gather all my ideas for so long. I'm like, this is gonna be so cool. I can't wait to get it done. It's gonna look amazing. And then I wouldn't start until like 8 o'clock that night before it was due. And then I would be upset because it wasn't perfect or it wasn't as good as I thought it could have been if I'd started ahead of time. And even with, I don't know, like Excel sheets, if there's one thing that's off and it's going to take me 5 minutes to fix, I still have to go back and fix it, even though it's fine. It's not hurting anything. And this is the one I've also struggled with, this. So picking at cuticles on skin. I don't know what it is. I don't know why I have this, but there's always something on my thumb that I pick at, and it's, I can't let it be because it can't be there. So I have to get it out. And it's really embarrassing for me, actually. I hate people are like, I feel like people are looking at my arms or something because they're just, I can totally see that there's something wrong, but nobody else is probably noticing. I was gonna put on makeup today to cover up my forehead right now, but I thought that would be, this is case in point right here, but you guys can't see it, which is good. But yeah, I'll spend hours unintentionally spending hours just on the little impurities in my skin when they're not hurting anything, or hours watching pimple popper videos, which I shouldn't be doing, but they're very satisfying and stress relieving. Yeah, that's something I struggle with. Anyway, the next thing, I don't know why this is not on any of the slides, on any of these lists that I got this information from, but procrastination is the biggest thing that we struggle with anyone that has ADHD, is procrastination. So next slide, please. I got to show you this very funny clip from Allie Broche, one of my favorite authors. She has a blog and she does a lot of writing about mental health. But she described procrastination the best way I've ever heard it. So procrastination has become its own solution, a tool I can use to push myself so close to disaster that I become terrified and flee toward success. That is the only way I can ever get anything done, ever. Like if there's no deadline, it's not getting done. Because like I said, I don't start things to the last minute just because it has to be perfect. There's a very strong connection between perfectionism and procrastination. And I've like looked at article after article for years about that. But yeah, I highly recommend her book. It's hilarious. And you're going to love it. So anyway, she also talks about depression and anxiety and just thing after thing that is super helpful in this day and age where mental health needs to be more talked about. So anyway, next slide, please. So I think I kind of thrown a lot of my story into the previous 2 slides, but I didn't get diagnosed until 2017. That was my junior year of college. And I guess one of the main reasons that my family I think they would have struggled to support me anyway. But I had been in a very unhealthy relationship around that time, and my parents didn't approve of it. So he had ADHD, and so he was maybe the 3rd or 4th person to mention it to me that I might have it too. And so their biggest excuse was, oh, you just think you have ADHD because he has it and he's convincing you and he's just manipulating you into thinking you have it. But it was, I mean, these signs had been there my entire life, and it hasn't changed just because I started dating someone they didn't like. So that was one of the things I was really upset about. So yeah, I didn't actually get accommodations for a while until maybe senior year of college. But if you think about it, like I really had been getting accommodations unofficially my entire life because I was a long test taker. And I think my teachers were nice enough to me to just let me have it unofficially. And they just had no problem letting me stay after school to finish a test or whatever. But I think there was a teacher in sophomore year of college who was like, hey, I can't really keep giving you these accommodations without some documentation. Like you need to get them through the right channels. So that's what kind of pushed me towards getting accommodations, even though I was so, I guess, ashamed of even getting tested. And then it just was a lot of barriers just to getting accommodations somewhat. Maybe they're more in my head, because after I got them, it was pretty easy. They were set up and it was fine. Medication, I actually didn't go on medication, like I said, until maybe a year before PA school. So for the time that I was getting the extra testing time, I was like, oh yeah, that's all I need, really. It's fine. But then I started noticing some things, like even in the emergency department that I used to work in, and sometimes during working as a volleyball referee, every once in a while there would just be such a time where I felt like my brain would just go in slow motion. Like I couldn't see the girl touch the ball, or I couldn't see if she touched the ball, or, with 2 hands or 1 hand. And I was like, why can't my brain see this and understand it at the same time? It was really frustrating. And then with the emergency department, I was like, oh, this is a great job for me, because I love running around. That running around is the only time I can function at my best capacity, right? And then every once in a while there would be a day where I'm just like, I can't remember the task that I was just doing because I got distracted by another task that came up at me. And then hours later, I remember that I've forgotten to go give someone a blanket, or forgotten to, just do the simple things, like, because they weren't the most pressing. Like if they didn't need CPR, they didn't need an EKG, there wasn't something time sensitive, then sometimes I'd forget and I would be really embarrassed about it. But yeah, so like I said, I went on medication before PA school, and I really only took it when I felt like I needed it. So I had a prescription of 30 10 milligram tablets of Adderall, and I made that last probably 3 months because I wasn't taking it every day like it said, which also led into some confusion later on with my provider. But anyway, that medication is not made to be taken just as you feel like it. There's no shame in taking it every day like it's prescribed, because that's the way it's going to be the most effective. I had to find that out the hard way, because I guess I just got so busy with PA school that I completely forgot that it had been a week since I took my last pill. And I was like at the lowest point I've ever been in PA school, which is why I finally started reaching out to a therapist. And during my intake appointment, the first thing she asked, like one of the first questions was like, are you taking your medication? And I said, it's probably been a while and I don't really take it every day. And I only take it when I feel like I need it, or like when there's a long day of classes. And she's like, that's the first thing we need to do. We need to get you taking medication every single day. And then we can work on the rest of the things you're feeling right now. And miraculously, I started taking my Adderall again, and I didn't feel so much depression anymore. And I was like, wow, this actually works. Why haven't I been remembering to do this? And something that one of the YouTubers I'm going to suggest in a little bit from How to ADHD, something she suggested keeping your medication like right by your bedside table. So as soon as you wake up, you have your water and your medication, and you don't even get out of bed first. You just go ahead and take it real quick. You can go back to sleep after you're done to give it some time to work a little bit. And you start your day refreshed. I'm like, wow, this works. It's amazing. So that's been really helping. I think I've also gotten a little bit inconsistent with it at this point in time, but hopefully I'm switching to Vyvanse soon, which is something that some of my other friends suggested that it worked better for them than Adderall. So if Adderall is giving a lot of side effects, if any of you are on it, or if any of your friends are on it, if Adderall is giving them a lot of side effects, just be like, hey, have you talked to your doctor about like Vyvanse or something? Because there's people describe it as just they finally feel normal. I haven't taken it yet, so I don't know, but I'm excited for that change, and that I finally found a provider who doesn't make me feel like a drug addict, or that I'm just going to use it to sell, or give to my classmates or whatever. I literally only had my first appointment with her a couple of days ago, and I was so completely relieved that for once that she was asking me how the medication was going, and I was honest with her, and she was like, oh, it's totally okay. Like, it's normal to go up on your dosage and everything. And, here's something for every day. And then here's something also for times when you need to study a little more, like when you need to really, really focus. So it's safe to take with the Vyvanse. And I'm like, this is amazing. I don't have to advocate for myself. You just get it. And I was like, what a relief. So if you ever feel like your needs aren't being met by either a therapist or a medical provider, always know there is somebody else out there that might have a better understanding of it. And it is completely okay for you to say, like, thank you for, what you've done for me this far. And I think it's time for me this is hard to say, but I think it's time for me to look for another provider. But no hard feelings. Thank you so much. I think I'm just going to search elsewhere. That's a very hard conversation, and there's a lot of tips online about how to end a relationship with a therapist or with a medical provider. I would look at those a lot before you ever have that conversation. And again, therapy is super helpful, but also make sure that your therapist is listening to you and not saying, oh, well, I just told you that using a computer for me is a terrible, terrible thing. If I use a computer during class to take notes, I guarantee you I will be on the internet, I will be on Excel, on Word, something else besides what I'm supposed to be on. And if she turns around and she turned around and told me that, she's like, oh, are you using your resources? You should really be taking notes on your laptop and computer. And I said, did you just hear what I said? Did you just hear what I said? So that really is really upsetting to me. So just make sure that you feel like you're being listened to. They're asking a lot of questions that are actually making you think about what's going on, and how you're feeling, and that kind of thing. So, and don't forget your diet and exercise, because that is one of the most important things to help you just function, and kind of get your mind clear and get in a good mindset to study, basically. So, also about accommodations, please don't ever feel like you're going to be less of a provider, or less than, or somehow you're going to be, not doing as good if you get accommodations in PA school. Like, that's something I struggle with too. I was like, oh, I'm just going to do PA school without accommodations. It's going to be fine. If I can't do it without accommodations, then I'm just not good enough. But that's not the case. Accommodations are important. If you don't get them in PA school, you will not get them on the pants. And if you fail your pants 3 times, you still have no way of getting the accommodations. So make sure you're getting your documentation in place, getting those accommodations in school. And do not shame yourself for that, because that's what they're there for, is to help accommodate, or to help, get you to the same level as somebody else, right? There's no shame in taking extra time. Yeah, and don't feel like you need to do it alone, or like do it without supports in place. Yeah. So here's some things that helped me. I really love this channel called How to ADHD. I think her name is Jessica, but she talks a lot about her struggles and about medication, about therapy, about just anything that's helped her or any struggle she's going through. And she's super relatable. Sometimes I'll put on these different channels for study music. Rainy Cafe is just cafe sounds and rain. That's it. It's simple. These other two are just instrumental music, so it's really helpful for I can't have any lyrics when I'm studying, so sorry, this is annoying. And then these are the 2 books by Ali Roche that I said are really, really helpful. A little bit cathartic, if that's the right word. But she struggles a lot with mental health, and she really gets it. So if you are also struggling, these are 2 really good resources to kind of feel like someone else gets it and that you're heard and it's okay to struggle. Yeah, so I hope you guys can check those out. Oh yeah, I'm also wearing this neurodiversity shirt from How to ADHD. I hadn't actually gotten to be brave enough to wear it until today. So she's got a lot of cute merchandise, like stickers and all that stuff. So check her out. And then some take-home points for us. Like I said, use accommodations. That doesn't make you anything. It doesn't make you less of a provider to need a little extra help, so that you're just functioning at your best capacity and, normally. Take your medications if you choose to. This is not, you don't have to take medication if you choose not to, but, if you're taking medications, making sure that you are taking it as prescribed every single day, and except for the couple of drug holidays, those are just kind of there to make sure that your tolerance doesn't increase as fast as it could without those. So drug holidays are just days during the week that you don't take your medication. Usually they say do like 1 drug holiday a week, and you want to try to keep it as consistent as possible so that you really get in that habit and don't forget, like I've forgotten several times. But that's really just there so that it can work the best and really make a difference in your life. And don't feel like you are drug seeking. Don't feel like you're irresponsible. Don't feel any shame toward it. There's no reason to feel any shame toward it. People take plenty of other medications for medical issues, and if they didn't take their medication, they'd be in big trouble, right? So there shouldn't be any shame in taking medication for ADHD so that you can focus and function to your full capacity. And then lastly, counseling and therapy. You may not think you need it, but I guarantee it will help. Because for a long time, I don't even feel like I learned a lot about ADHD and knew a lot about it, how it affected people, how it was different between male and female. And that brings me to another point I forgot. But it's just different. It takes some time for you to learn about yourself and how to best cope with the things you're struggling with. And that's a really good way to get help. Also, I talked a lot about how symptoms are different in male versus female. All those symptoms that I had up earlier were specifically for the female presentation, but I didn't mention how it would present in your trans patients or transgender patients or non-binary patients. Does anybody have any, and I'm mentioning this because it's Pride Month, and I want to make sure that we're all being as inclusive as possible. Does anybody have any thoughts about what kind of symptoms you present with? Basically, I'm not going to tell you either way, because I want you to make sure that you are not excluding a diagnosis based off of if your patient is presenting in a way that you think would match up with either their previous gender assigned at birth or their current gender identity. So, and even for boys, you expect the hyperactive form of ADHD, but they can also have the inattentive version. So just because, a male is coming to you in their college years doesn't mean they don't have ADHD, or they should have gotten it diagnosed beforehand, right? Or they don't have it. Same for females, like maybe they did get diagnosed really early on because they were pretty hyper when they were a kid. But I mean, if you have a non-binary patient, you also would not want to exclude this diagnosis from them just because it doesn't match what you would expect. So I don't really know that there's been a lot of research on this. There always needs to be more research on LGBTQ plus populations and every patient population, especially with different ethnicities and stuff like that. So I just wanted to throw that in there for Pride Month. Does anybody have any questions for me? I think I touched on everything, didn't I? Yeah. That was a lot, sorry.
Thank you so much for talking about your condition. It's really insightful. I just had a quick question. Do you talk about your ADHD in your application for PA, or did you set that aside?
I don't think I did. Yeah, I think at that point I was like, I'm just not gonna worry about it. I'm not gonna talk about it. I'm just gonna be normal, right? I did talk about, I thought about trying to do the Navy to get them to pay for part of the school. And I did tell them, because I think I don't think I was taking medication at the time, but I mentioned to them that I had ADHD, and they're like, oh, well, do you take medication? I was like, I mean, I don't think I'll really need to after school. And they were like, okay, well, don't mention that on your, and well, as long as I have medication that it's fine, or usually when I'm working with my hands, it's fine. I shouldn't have to lie to get into the military, so that was really, it kind of changed my direction a little bit. That wasn't the only reason that changed my direction as far as applying to the military for that reason, but that was a big thing. Like, I don't want to be paranoid and just not say anything about ADHD and then think that I might get caught later on for lying to the military. That's a big deal. But I also don't want to be disqualified because of that. But, we have the American Disability Act where it says you can't be disqualified, but I'm not sure if the military is an exception there, because there's those, we're talking about, they're the abilities that you have to perform the job, basically. Same things for PA school, like Haley was mentioning earlier, but yeah.
Thank
So
you.
I don't think I mentioned it. Yes, Elise.
Hi, thank you so much for presenting that, because I was on my psych rotation in PA school, and I basically figured out I had ADHD. And so it's just been like a journey, because all the things you said, I kind of do the same thing. And it just made sense why I struggled so much in didactic. Like, in order for me to pay attention, I had to sit at the very front of the class, right in front of the speaker, or else I couldn't. And I just really wish I would have been diagnosed earlier, because maybe it wouldn't have made didactic so hard for me. But like, now that I know, that I have this, I'm doing the things that I need to do to get better. And I'm feeling a whole lot better than when I did before I knew, because I knew there was something wrong, but I just couldn't put my hand on it until I started seeing people with like ADHD. And I was like, oh.
Yeah, I'm so glad you're feeling better about it. And I again, I hate that we were so diagnosed so late, because it does help a lot once you can identify the problem. And it wasn't even that I wanted to make excuses for like turning things in late or whatever. That's my parents just thought it was an excuse. But yeah, I mean, it does change. It changed the didactic year completely. I remember being in the very back of the class, just feeling almost paralyzed to like even move my hand to write any notes, like knowing that I shouldn't use my computer because it was gonna to get me off track, but I couldn't even move my hand. And I don't not like physically, I could move it, but it just was so hard to find the motivation. And I'm like, I don't understand why I can't do the simple thing as just like write something down for later. And I'd never had experienced that before until PA school. And it was just scary almost. But yeah, thank you so much for sharing, Elise. And I'm glad that I could be a little helpful. That was something else I was gonna tell you guys, but I forgot. Anybody else have any questions or comments I want to share? Has anybody ever had like friends that have had ADHD and you're like, oh wow, yeah, it's so obvious? Or like have any experience just at all with ADHD besides having it yourself?
I have a couple friends who do, and one of mine is even in school with me, and he was diagnosed actually during school, and started on medications during school, and it was actually kind of amazing to see his like process go from like not being medicated to being medicated, and then also like how it improved his anxiety and depression, treating his ADHD as well.
Yeah, that's such a relief when you can get like finally get past the anxiety and depression. And it kind of takes you by surprise too, because you don't like you could be doing good one day and then suddenly you just are so depressed because you're so putting so much shame on yourself for not getting done the things you want to get done, or just getting stuck in the self comparison. That's really, really hard. So, I keep forgetting the thing I'm going to say, and I remembered it just a minute ago. Oh, it's almost there. Hold on. Emily, what have I said to you all the time that I've forgotten? Well, if I remember it, I'll let you know.
That's all right, Kayla. Just let us know if you think of it. Thank you so much for sharing that. I learned so much from you. I'd kind of been talking to people in the chat about, my own personal story with ADHD as well. I wasn't diagnosed until I went through PA school the first time. I had 2 weeks left in fall semester and got my diagnosis. I needed a 90 on my final exam in medicine, and I did not get it. So I failed out of PA school and had to go through a process to be able to decelerate. So I felt a lot of guilt and I felt a lot of shame and didn't want to talk about it initially. But I'm glad that we're talking about it and shedding a light on it.
Yeah, thank you. That must have been so hard. So hard. I think that there's so much improvement that can be done in like the remediation area of PA school when you're like that close to on the line, on the border. And I don't think, that's just so hard on you mentally to have to restart everything. And I have a friend that has that experience too. So trying to be supportive of him has been, we're doing the best we can. But I do remember what I was going to talk about now, if you guys don't mind. The testing to get an ADHD diagnosis is the hardest and most stressful thing I've ever done. Just sit there for like 3 to 6 hours and answer these questions that, at first are supposed to be, they're easy at first. And then they're a little harder and a little harder. And then you're getting to, it's like so anxiety provoking. You get to the end and you're like, I'm supposed to know this. I haven't seen this since high school. Like, come on, I can do this math, or I can finish this sentence. And I just remember the proctor asking me if I needed to take a break, and I'm like, I don't want to take a break. I want to finish this. But then I was getting really angry at myself, and so I would take a break, and I'm like, this is so dumb. Like, I just need to do better. These aren't even academic tests. They're not testing me academically. They're testing for my reaction to this stuff, and I'm just making it worse. So unfortunately, I had to go through all that testing again right before PA school, because I was just outside the I guess the 2 or 3 year mark of getting diagnosed. And I was like, I will not do that again. I can't, no, I just won't. And I eventually did anyway, but I really didn't want to do that. It was so stressful. And I was like, why can't you just accept it? It was only like it's like less than a year difference than, for my diagnosis. I'm like, it's not going to change. I'm going to have ADHD for life. It's not going to change. You don't just grow out of ADHD. But yeah, I went and did the retesting again, because that's the only way I was going to get accommodations. And before, like the first time, I think I finished all the questions, even when I didn't want to, and I was super stressed, or I would just say like, all right, I'm done. But this second time was even worse. Like at one point I was like, no, I'm just done. I'm just done. Even though I was like spending way longer than anyone else would trying to get the same, like just an answer, any kind of answer, even if it was wrong answer for a question. So just encourage your friends or, yourself, if you're looking at retesting. It is overwhelming and super hard to put yourself through again, but the accommodations are worth it. Yeah. I love hearing your guys' experience. So thank you so much for sharing. And at some point, I do want to know more about everybody's remediation processes at your school, because I think there can be a lot of improvement.
Awesome. Thank you so much for sharing, Kayla. Tiffany, can I have the next slide, please? Were there any other questions that anyone else wanted to ask, about PAS Lead, about Kayla, about Haley? And feel free to type it in the chat if you didn't want to, if you don't want to unmute yourself and ask the question. All right, well, if you think of anything, like I said, please feel free to unmute yourself and put it in the chat. We're going to show you a couple of just wrapping up some things about PAS Lead, and then, we'll let you get back on with your lives. So next slide, please. We are looking for new directors. Like I mentioned earlier, Kayla is one of our newest directors. She's been with us. Has it been a month yet?
I think it's been like a week.
It's been so much longer.
Yeah, just like, let me get down then on this presentation and do all the cute things, all the colors and stuff.
So Kayla has hit the ground running and has done great work with us. So if you're interested in a leadership position, definitely apply to be one of our board of directors. You can go on our Instagram or go on our website to fill out the application. If you're not interested in being a member of our board, you can just be a member of PAS Lead in general. We do have a national group chat with pre-PAs and PA students that you're welcome to join, and there's an application for that, and that's just, it doesn't cost anything. It's just to give you a little bit more background about the organization. Next slide, please. Like I mentioned earlier, please save the date. Our second annual Racial Social Justice Conference is going to be on November 5th, 2022. Keep following us for more details. If you missed out on the first one, want to relive it, or just want to know more about it, please feel free to go to our website. That's www.paslead.org. And there's a section for the conference where you can watch each individual presentation and kind of like pick and choose which ones you're interested in. And just save that date. We'll be giving out more information soon. Next slide, please. These are all the list of our current directors. So, feel free to like take a picture of that, email us, contact us if you have any further questions, about the director position, just about us sharing our personal stories. We're definitely happy to answer whatever questions that you may have. This is another way for you to sign up for our national chat in the GroupMe. So there's an app that's called GroupMe. It's just a messaging service. So feel free to take a picture of the QR code. It'll take you directly to be able to sign up for it. You just have to download the GroupMe app. If you don't have it, it is a blue chat bubble with a white hashtag in the middle. And feel free to sign up and become a leader. Thank you so much for being here today. These are all the different ways that you can contact us and follow us online.
All right, everyone, thank you so much. We're going to stop sharing our screen. Again, any questions, but we thank you all for being here.